Hey guys, what's up? This is Dr. Sandy Bell, and now I'm going to teach you about hip mobility. This is really important, again, if you're a runner, if you're going to Kaya, if you're doing CrossFit, any of those types of exercises, it's going to be really important you have good hip mobility, because if not, it can end up causing pain in your lower back, it can end up causing problems in your knee, and so on and so forth. So I want to teach you a couple of real simple exercises that you can do at home so that, one, your treatments are more effective, and two, they hold really, really well. And I got to give my trainer Justin some credit for this one, and Kelly Starrett, because they are the people who taught me this. So I want to make sure that the proper people get their dues. Okay, so basically what you're going to do with this is you're going to take a real strong band. I'm using a black band. You may not need a band as strong as that, but I'm going to use a black band for right now. And basically, to get this hip, what we want is we want to pull this hip joint forward so we can stretch the psoas muscle, which is one of your main hip flexors, and then what's called your anterior hip capsule, which you'll hear me talk about a lot in the office because a lot of people have really tight anterior hip capsules. And where that ends up becoming a problem is if you're trying to get a squat and you're trying to get down, you don't have that hip mobility. It's going to end up causing you having to lean forward, and that'll cause back problems. So what you're going to do is you're going to take this band. There's a couple different steps to this. The first step is you want to just step your foot into the band, just like that. The second step is that you're going to take this band and you're going to pull it all the way up to about where your butt bone is right there. And so you want to get in here and pull that all the way up. Now the next step is you want to just take a couple steps back, as many as you can, without the band pulling too hard on you. And then what you're going to do is you're just going to drop down into like a lunge position. And right now my muscles are on. You just turn everything off and let the band pull your hip forward. So I'm feeling a huge stretch right through my psoas muscle, right through the hip capsule area. This feels great. When you get up from it and then you do a squat or you go walking or something, you'll feel like you're floating. This is a really, really great hip stretch. And then you also want to learn how to get out of this. So you'll hold this for about 30 seconds or so. And then to get out, you just hold the band like this and then come back. And there's one other little caveat that I want you to see here, and that is when you're coming back, it's actually a little easier to grab the band and pull back this way. And so there's no tension yet, and then you can let it go, and then you'll get more tension when you're stretching. So I forgot to show you that at first, but make sure you grab this, and then when you're getting up, grab it. Come back so that you don't snap the band and hit somebody on the other side. Okay, and again, this is something you can do at the gym. It's also something you can do at home if you just have a band and a pole somewhere. It'll cost you $20 to do that. All right, this is Dr. Sandy Bell, signing off.